Week 12 at the Georgia Capitol marked the end of the 2026 legislative session, known as Sine, where lawmakers finalized the state budget and wrapped up major health legislation. In the final days, a conference committee resolved differences between the House and Senate to pass Georgia's fiscal year 2027 budget, which now heads to the governor for approval. So what's in the final budget for healthcare? At a high level, the agreement splits the difference between the two chambers on key issues like Medicaid rates, workforce investments, and rural health funding. There are some important wins. The state will fund 900 new waiver slots for Georgians with intellectual and developmental disabilities, the largest single-year investment of its kind, though thousands remain on the wait list. Medicaid provider rates will increase in several areas, including a 5% boost for primary care and expanded support for autism services. The budget also expands maternal home visiting programs to more counties, supporting better outcomes for moms and babies. But there are also trade-offs. Some behavioral health workforce investments were left out. Rural health funding was only partially restored, and deeper cuts to reinsurance funding could put pressure on insurance premiums moving forward. Beyond the budget, several key health bills passed this session. Lawmakers approved protections against surprise ambulance billing, expanded access to HIV prevention medication through pharmacies, and created new pathways to strengthen Georgia's healthcare workforce, including support for internationally trained physicians. At the same time, some important priorities, like establishing certification for community health workers, did not make it across the finish line this year. What's next? The final budget now heads to Governor Kemp, who has the authority to veto specific spending items. We'll be watching closely to see how those decisions impact healthcare access across Georgia. As the session comes to a close, the decisions made at the Capitol this year will shape coverage, care, and costs for Georgians in the year ahead. Read our full Week 12 legislative update at healthyfuturega.org/blog.